Hi, my name is Bill Dager. I'm a pharmacist from the University of California, Davis Medical Center. And today we're going to talk a little bit about the effects of Idarucizumab on high Dabigatran levels and how much a single 5-gram dose may reverse a patient who's at very high levels of Dabigatran. Kind of as an introduction, with any antibody, it usually neutralizes just so much drug. So in most cases, the amount of antibody necessary for full neutralization may require a set amount, but when patients have super high amounts of the drug on board, it may require additional amounts of antibody. And for Dabigatran, this was never fully defined as far as how much 5 grams actually will reverse. So our aim in our analysis was based on 2 patients that we had, and in our facility we can measure Dabigatran levels. So we had 2 patients that we were suspicious of high Dabigatran levels because their INR values were very high. And given the fact that we were able to measure the Dabigatran, we actually measured the Dabigatran levels, and in one case it was around 1,300 nanograms per ml, and in another case it was over 2,000 nanograms per ml. So we gave the 5 grams of Idarucizumab, and then subsequently we measured the Dabigatran level after the 5-gram dose. And we found between the 2 cases that actually a 5-gram dose of Idarucizumab seems to remove somewhere around 800 or 900 nanograms per ml of the Dabigatran. So a key part from these 2 cases is that in your patients who have very high INR values may truly have very high Dabigatran levels, and that the 5-gram dose may not be sufficient for full reversal. Neither of these 2 patients were overdose patients. They were high for other reasons. So it's something you should be aware of when you're dealing with these patients, is that sometimes in very rare situations additional drug is necessary. One trick to know is that after you give the 5-gram dose, if you want to kind of see if you got full reversal, so you can always check a thrombin time. And if it's still off the scale and they had very high INR values, you might be suspicious that there might not be full neutralization of the Dabigatran with the 5-gram dose.